Well, most Wednesday mornings we take a few moments to highlight some of the health issues that you or your family may be facing. And as usual, we're joined by Dr. Shelley Duggan. Morning, Shelley.
Good morning.
February is Heart Month.
Yes.
So it would be only right for us to talk about something heart-related. And today we're going to talk about congestive heart failure. What exactly is that, Shelley?
Yeah, so basically, lots of things can affect the heart, and eventually that heart muscle is going to be affected and not work well. So when that heart muscle can no longer pump blood as effectively as it did when we were younger, then we get congestive heart failure. And the main symptoms that people are going to get from that is really a buildup of fluid. So whether that's swollen ankles, fluid in the chest so that they're short of breath and maybe coughing. Some people get fluid in their belly, and generally they just feel quite fatigued as well.
So this is totally unrelated to a heart attack?
No, actually the most common cause of heart failure would be, what we call coronary artery disease or heart attacks that have damaged the heart muscle. But there are other causes of congestive heart failure. Hypertension, though, would be a very important cause. So just hypertension in and of itself can cause that. But also some people can have valvular abnormalities, maybe born with some valve problems, or rheumatic fever if they had that as a child. Certain medications, for instance, chemotherapy drugs can cause this problem. So it is a common thing that we see, particularly in an older population.
You talked about the symptoms, which to me seem to be a little more chronic, as opposed to the heart attack, which is boom, you're supposed to know you're getting a heart attack. With congestive heart failure, not necessarily the case.
Not necessarily. You may just find that over the course of time, so if you've had, let's say, uncontrolled high blood pressure for many, many years, you may find that over the course of months that you start to notice swelling in the ankles, that you get short of breath when you lie flat at night. So the symptoms aren't necessarily dramatic, although people who have fairly weak hearts, who know they have heart failure, will get sort of exacerbations and end up in hospital because all of a sudden they just fill up with fluid and can't catch their breath.
And I'm assuming if something isn't done about this relatively quickly, then some bigger problems could arise.
Yes, so certainly people die all the time from congestive heart failure, but mostly we can do medication management and dietary intervention. So you're going to want to keep that salt to a minimum, for instance, but also medications that can help improve how the heart functions, and water pills, diuretics, that can help get rid of that excess fluid. For some people, they may be candidates for invasive therapies like ventricular assist devices as a bridge maybe to transplant. But that wouldn't be, for everybody. Certainly as we get older, we're not candidates for those types of things.
So the issues that we see that are heart-related to those who are younger, not necessarily this type of heart failure. I mean, they're caused from other things.
There can be, but, if we go back to what's common, the common causes of congestive heart failure are going to be coronary artery disease and high blood pressure. And so what I, harp back on, which people hear me talk about all the time, are risk factors, right? So obesity, alcohol, smoking, diabetes, all those things, can lead to, an increased risk for congestive heart failure. So yet another reason for a healthy lifestyle.
Sure, and if it's in your family, if you know your parents and your grandparents have had this, then it's something you should really keep a close look on, I'm assuming?
Absolutely, but it's important for us to take responsibility for our own health and to do those things that the doctor can't do for you, which is try to maintain a healthy lifestyle.
Is this related? This is another issue altogether, but I've heard the term AFib, and since it is Heart Month, what exactly is AFib?
So atrial fibrillation is just a different heart rhythm, and certainly, atrial fibrillation can lead to heart failure, but certainly people who have congestive heart failure often are either permanently in atrial fibrillation or go intermittently into it. It's just a different way that the heart beats, and often the heart rate can be quite fast, and some people can be quite symptomatic. So often heart failure and AFib go together.
All right. Thanks, Shelley. If you have a question you'd like to ask Dr. Duggan, whether it be your heart or anything else to do with medicine in general, just send it to this email address. It's edmonton@globalnews.ca. Make sure you put Ask the Doc in the subject line, and join us in future weeks for more great advice from our medical expert.